nervous system consists of central nervous system, peripheral nervous system, and autonomic nervous system. Central nervous system includes the brain and the spinal cord. The brain, it is enclosed in a vascular connective tissue, meninges, and protected by bone, the skull. It is formed of cerebrum, brainstem, and cerebellum. Cerebrum is subdivided into telencephalon, formed of two cerebral hemispheres and the basal nuclei. Rhyencephalon, or olfactory brain, formed of olfactory bulb and tract, piriform area, amygdaloid nuclei, hippocampus, and the fornix. Diencephalon, formed of the thalamus, hypothalamus, epithalamus, and metathalamus, medial and lateral geniculate bodies. Brain stem, which includes midbrain, bones, and medulla. Cerebellum lies in the occipital fossa. It is covered by tentorial membrane. It is separated by the cavity of the fourth ventricle from the brain stem, to which it is attached by three fiber bundles called peduncles. It is attached to the midbrain by the superior cerebellar peduncle, to the bones by the middle cerebellar peduncle, and to the medulla by the inferior cerebellar peduncle. Spinal cord. It is the second part of the central nervous system. It is enclosed in a vascular connective tissue, meninges, and protected by the vertebral column. It is formed of several segments: 8 cervical segments, 12 thoracic segments, divided into upper 6 thoracic segments and lower 6 thoracic segments, 5 lumbar segments, 5 sacral segments, 1 coccygeal segment. Peripheral nervous system, PNS. It is formed of cranial nerves, 12 pairs, spinal nerves, 31 pairs, ganglia, cranial and spinal, and nerve endings. Autonomic nervous system. It is formed of sympathetic part and parasympathetic part. Covering of the central nervous system, the meninges, the brain, and the spinal cord are both covered with 3 membranes, meninges. These are from outwards inwards. Dura mater. It is an outer, dense fibrous coat with some elastic fibers. It is continuous with the periosteum of the skull and is split in certain sides to contain large venous sinuses. On the other hand, the dura that envelops the spinal cord is separated from the periosteum by an extradural space containing loose and adipose connective tissue with blood vessels. The dura is separated from the arachnoid matter underneath by a subdural space containing a watery fluid, not CSF or cerebrospinal fluid. CSF. The arachnoid matter is formed of delicate trabeculae of connective tissue connecting with the pia mater. covered by simple squamous epithelium. The trabeculae are separated by spaces filled with cerebrospinal fluid, CSF, called the subarachnoid space, which is traversed by the large vessels of the brain. In some areas, arachnoid perforates the dura mater, forming protrusions terminating in the venous sinuses of the dura and covered by endothelial cells of the veins. These protrusions are called arachnoid villi. Their function is to reabsorb cerebrospinal fluid into the blood of the venous sinuses. Pia mater. It is a delicate vascular membrane closely investing the central nervous system. It is formed of simple squamous epithelium on the outside and underlying layer of collagenous and elastic fibers containing fibroblasts, macrophages, and blood vessels. Blood vessels penetrate the central nervous system through tunnels covered by pia mater, perivascular spaces. Coverings of the spinal cord. The spinal cord is covered by meninges. Dura mater is the outermost, followed by the arachnoid mater, then the pia mater, which is the innermost. Pia mater is a fibrous membrane attached to the spinal cord, from which connective tissue septa carrying blood vessels penetrate the white and gray matter for nourishment. Vascular pattern of the central nervous system. The central nervous system, CNS, is supplied by blood vessels arising from the rich vessels of the pia mater. These enter the brain through tunnels lined by invagination from the pia perivascular spaces. At first, the large vessels are surrounded by a perivascular space, which contains reticular fibers and cerebrospinal fluid continuous with that in the arachnoid. When the vessels get smaller, the perivascular space disappears, and the vessel breaks up near the nerve cells into fine capillaries, which are completely covered by neuroglial cell processes. These collect into venules and veins draining into the pia vessels. Blood-brain barrier. It is a functional barrier that prevents the passage of some substances as antibiotics and chemical from the blood to nerve tissue. It results from reduced permeability, which is the property of nervous tissue capillaries. It is formed of the cytoplasm of the endothelial cells lining the capillaries is of a continuous type, does not have fenestration. The presence of a tight basement membrane surrounding the capillaries. The expansion of neuroglial cell processes surrounding the basement membrane. The significance of blood-brain barrier. It protects the highly sensitive and vulnerable nerve cells from some injurious substances which may enter the bloodstream by injection. It prevents the occurrence of edema. This is because the central nervous system has no lymph vessels to drain the excessive tissue fluid, like elsewhere in the body. So the tissue fluid produced in the brain must be so little, for the venules only are responsible for its drainage. Choroid plexus. Choroid plexus consists of invaginated folds of bimatter rich in dilated fenestrated capillaries that penetrate the interior of the brain ventricles and fuse with the ependymal cells. It is found in the roofs of the third and fourth ventricles and in part in the walls of the lateral ventricles. The choroid plexuses are branched structures made up of numerous villi, thus providing a large surface area for the secretion of CSF. The villi have a highly vascularized connective tissue core derived from the bimatter, containing tortuous tufts of congested capillaries with higher hydrostatic pressure. The villi are covered by a modified ependymal cells, simple cuboidal or low columnar secretory cells with granular cytoplasm and microvilli. The main function of the choroid plexus is to elaborate cerebrospinal fluid, which contains only a small amount of solids and completely fills the ventricles, central canal of the spinal cord, subarachnoid space, and perivascular space. Cerebrospinal fluid. Cerebrospinal fluid is a modified tissue fluid present in the biarachnoid space, acting as a fluid cushion in which the central nervous system is suspended and protected as the brain and the spinal cord. Cerebrospinal fluid is a slightly alkaline fluid, similar to plasma in containing the same salts as sodium and potassium chloride, but differs from plasma in having little proteins, sugar, and few lymphocytes. Examination of cerebrospinal fluid is therefore valuable in diagnosis of brain injuries or infections. Cerebrospinal fluid is secreted by choroid plexus and ventricular ependymal cells. Cerebrospinal fluid is important for the metabolism of the central nervous system and also acts as a protective device against mechanical shocks. Blood cerebrospinal fluid barrier. It separates the blood present in the blood capillaries of the brain from the cerebrospinal fluid. It is formed of the capillary endothelium of the continuous type, not fenestrated, a tight basement membrane surrounding the capillaries, the cubical ependymal epithelium. Circulation and reabsorption of cerebrospinal fluid. Cerebrospinal fluid passes from the lateral and the third ventricle through the aqueduct of the midbrain, aqueduct of Sylvius, to the fourth ventricle, from which it escapes through its roof to the subarachnoid space. From there, it is reabsorbed into the bloodstream by the arachnoid villi which project into the venous sinuses. Two factors aid drainage. The hydrostatic pressure in the villi is higher than that in the sinuses. The osmotic pressure of the blood is higher due to its high content of protein than that of the CSF due to its low content of protein. The brain cerebrospinal fluid barrier. The cerebrospinal fluid in the ventricles does not escape to the brain tissue because it is separated from it by a barrier, which is formed of ependymal epithelium, its basement membrane, condensed neuroglial fibers underneath the ependymal epithelium. Also, in the subarachnoid space, the cerebrospinal fluid is separated from the brain tissue by the squamous epithelium of the pia mater, its elastic and collagenous fibers, and the condensed neuroglial fibers underneath the pia. Cerebrospinal fluid circulates through the ventricular system to subarachnoid space. Impairment of CSF normal flow leads to its accumulation and a condition which is called hydrocephalus. Hydrocephalus is a progressive enlargement of the head followed by mental impairment and muscular weakness.